Coronary artery. The right coronary artery arises from anterior aortic sinus of ascending aorta, immediately above the aortic valve. Course. After arising from the ascending aorta, the right coronary artery first runs forward between the pulmonary trunk and the right auricle, and then it descends almost vertically in the right AV groove up to the junction of the right and inferior borders of the heart. At the inferior border of the heart, it turns posteriorly and runs in the posterior AV groove up to the posterior interventricular groove, where it terminates by anastomosing with the left coronary artery. Branches and distribution. Right conus artery. It supplies the anterior surface of the pulmonary conus. Atrial branches. They supply the atria. One of the atrial branches, the artery of SA node, is also called sinoatrial nodal artery. Supplies the SA node in 60% cases. In 40% individuals, it arises from the left coronary artery. Anterior ventricular branches. They are 2 or 3 and supply the anterior surface of the right ventricle. The marginal branch is the largest and runs along the lower margin of the sternocostal surface to reach the apex. Posterior ventricular branches. They are usually 2 and supply the diaphragmatic surface of the right ventricle. Posterior interventricular artery. It runs in the posterior interventricular groove up to the apex. It supplies posterior part of interventricular septum, AV node in 60% cases, and right and left ventricles. Coronary artery. Its origin. The left coronary artery arises from the left posterior aortic sinus of the ascending aorta, immediately above the aortic valve. Course. After arising from the ascending aorta, the left coronary artery runs forward and to the left between pulmonary trunk and left auricle. It then divides into an anterior interventricular and circumflex artery. The anterior interventricular artery runs downward in the anterior interventricular groove to the apex of the heart. It then passes posteriorly around the apex of the heart to enter the posterior interventricular groove to terminate by anastomosing with posterior interventricular artery. The circumflex artery winds around the left margin of the heart and continues in the left posterior coronary artery, coronary sulcus, up to the posterior interventricular groove, where it terminates by anastomosing with right coronary artery. Branches and distribution. Anterior interventricular artery. It supplies anterior part of interventricular septum, a greater part of left ventricle, and a part of right ventricle, part of left bundle branch of His. Circumflex artery. It gives a left marginal artery that supplies the left margin of the left ventricle up to the apex of the heart. Diagonal artery. It may arise directly from the trunk of left coronary artery. Conus artery. It supplies the pulmonary conus. Atrial branches. They supply the left atrium. Venous drainage of the heart. Venous blood from the heart drained into right atrium by the following: coronary sinus, anterior cardiac